Hello, good morning or good afternoon, depending on where you're Zooming from today. I'm David Rousseau of the Kaiser Family Foundation, or KFF, where I oversee our journalism and digital communications. On behalf of our terrific colleagues on the Media Impact Funders Board, which I'm privileged to chair, and its amazing staff who organize this and all our programs, I'd like to welcome you today to this installment of our virtual 2021 Media Impact Forum. Thanks so much for joining us. The first two sessions of this year's Media Impact Forum focused on the ways that funders can and are currently using media to support vaccine confidence and access efforts. With all the work being done in this space, though, we're thrilled to offer this third session today, featuring some innovative approaches to use media and support media to increase confidence and access to the COVID vaccine. Before I turn it over to our Master of Ceremonies today, MIF's Executive Director, Vince Staley, I'd like to thank those of you who are already members of MIF for your support, and to encourage those of you who aren't members to consider joining us in our effort to serve and expand the field of media funders. With that, I'll turn it over to Vince and our great panelists, and I look forward to today's discussion. Thanks.
Thank you, David. Really appreciate your welcome for this special program. It's been a really interesting series of programs at the forum this year. Every one of them is focused on evidence-based communications and the importance for science, health, and the environment, and for the health of our democracy. And we've already addressed issues related to the COVID vaccine and communications around that. And we found that this area was so rich that it actually required us to go deeper and hear from some other important philanthropic players who are doing really robust work in this area. And so we're happy to give special attention to three of these major players in this session. And we're going to go right back to the Kaiser Family Foundation. We appreciate that David provides the guidance as our chair, but also we want to hear now from Tina Hoff, who is a senior vice president with Kaiser and director of social impact media, to tell us about some of their special efforts in this regard. And Tina is hobbled by electricity outage, so she's on her phone today. Thank you for winging it, Tina. Hopefully your power on your phone is enough to carry you through this, but if not, we've got Robin Kistler backing her up from Kaiser and providing the slides. So thank you for your flexibility.
Great, thank you, Vince. Thanks for having us here today, and it's great to be talking to all of you this morning. As Vince said, I am here to talk about some work that we have been doing focusing on vaccine information needs in communities of color. Next slide, please. I think many of you are probably familiar with KFF already, but just our usual caveats. We are a national nonprofit health organization with no affiliation to Kaiser Permanente. As an information-driven organization, we focus on getting out health information to communities in need. We do that through our policy analysis, our public opinion research, our journalism programs, and our social impact media work. Next slide. For the past 2 decades, we've been doing HIV communications campaigns, including running some of the largest public information partnerships and earliest ones with partners like MTV, BET, Univision, and Viacom. We've been building on this work in the last year to launch Greater Than COVID, a public information response to help individuals navigate the evolving pandemic. And toward the end of this year, we started shifting those efforts to look at vaccine information needs. Through our COVID Vaccine Monitor project, which tracks public opinion, knowledge, and experiences with the vaccines, we saw early on that a significant share of the population had significant information needs to be answered before they could make a decision about moving forward. This data that you're seeing on the screen is from January when we started developing our messaging work, and we've continued to see people progress forward as they get information. What we also saw from our research was that many of those who fell into our wait and see category, that is, they were waiting to make a decision about getting the vaccine. Next slide. We're looking to see how had questions about how well the vaccines worked, about the process by which they were developed, how safe and effective they are. I think all reasonable questions that many people would have given how new the vaccines were. And we saw a need to address those with trusted messengers. Our research also showed, you can go to the next slide, please, that the people that those most want to hear from are healthcare providers, doctors, nurses, community healthcare workers. These are among the most trusted voices in responding to some of these information needs. And we saw that this is information that we've also seen through our HIV work. We had a long-running project called Ask the HIV Doctor with Greater Than AIDS. And so we took these learnings and this experience to launch a campaign last March with Black healthcare providers. Next slide, please. Called The Conversation, Between Us, About Us. We teamed with the Black Coalition Against COVID for the campaign, which features Black doctors, nurses, and researchers answering the common questions that we heard from the community about the COVID vaccine. W. Kamau Bell, who is the comedian and host of CNN's United Shades of America, hosted the series with us and anchored a launch video in which he talked to the healthcare workers about some of the most common questions that we heard. I want to take a minute to share that video with you from the series. I'm going to ask Robin to tee it up, please, and play it for you.
Hello, Black America, and people who pay attention to what Black folks are doing. My name's W. Kamau Bell. There's good news out there. There's a COVID-19 vaccine. Yay! But the bad news is, as Black folks, it's hard to trust what's going on. So what do? Well, we turn to people we can trust, Black folks. But not just your uncle at the cookout. No. Actually, not him at all. I'm talking about Black scientists, Black doctors, and Black nurses. Okay, first question. The vaccine happened fast, like super fast, like Usain Bolt headed to the bathroom fast. Is that something we should be concerned about?
Having an emergency authorization for these medications was critical, but that doesn't mean any steps were cut.
Anything where money could be traded off for time, that was happening. Like, money was no object.
They still have all of the rigor that they use for approving any vaccine. So we can feel confident that the science is still there.
The messenger RNA technology has been in development for the last 12 years. So even though you hear this thing about warp speed, believe me, that was not warp speed.
And I think the data is real. It suggests it's highly effective.
About a week or so after your second dose, the people who had gotten the placebo or who didn't get the true vaccine, their rates of coronavirus continued to climb, whereas the people who had gotten the vaccine, it just flattened out.
And what about side effects?
Soreness from the injection site.
I had a little bit of arm soreness.
Arm sore? Is that a side effect? My arm's sore right now.
The common things, soreness at the injection site, headache, fever, maybe a swollen lymph nodes.
The second dose is when there's more common, those systemic side effects.
Is this like one of those pharmaceutical commercials where at the end they talk real fast about the side effects and it's like, you're also gonna get hair from your eyeballs and vampirism?
My sister texted me the second day after I got the first vaccine, and I remember she was like, "Are you a zombie yet?" And we just laughed, like, "No, I'm not."
So the big answer is no. And the reason being is we are not injecting the virus into your body. The vaccine is training your body.
It is making those antibodies to fight that disease. So I view it as a positive thing.
So here's a question from everybody's uncle, and since I'm an uncle, it's a question from me too. Are the drug companies just trying to get rich off this?
The drug companies will certainly get rich.
Oh, drug companies are always trying to get rich, but that's not the point, right?
That is really how a lot of our innovation happens. That is why the drug companies will spend millions upon millions in research.
Were Black and brown people a part of this process, or was it only like white folks, like NASCAR white folks?
The trials were intentionally broad and inclusive.
Yeah, Black and brown folks have been recruited for the clinical trials.
We have ensured that each of the 4 historically Black medical schools, that we are all vaccine trial sites.
So here's the big question. How much are you charging us for this vaccine?
Right now, getting vaccinated is free.
Free?
Yes, it's free.
Like free.
It will be free.
Like not even free 99.
We have not charged anyone.
Okay, should I be suspicious that you aren't charging us?
No, because there are some things that the government invests in that for the good of the people.
Taxpayers like you and I contributed to development of these vaccines.
What if I'm not worried about getting COVID-19?
Like you could say, I never had smallpox, I've never had tetanus, why do I need the shot? That's why we give vaccines. Vaccines are prevention.
I pretty much tell people you're gonna be exposed some kind of way, right? So you better be ready to fight.
And what about you? Have you? Will you?
I got my first dose about 3 weeks ago.
I have not gotten the vaccine yet, but rest assured, I'm anxiously waiting.
I definitely will be getting vaccinated when my turn comes.
I was scared getting it, and then after I got it, I was like, oh, well, I guess it wasn't that bad.
When the vaccine went in, I felt this intense amount of honor.
Like a lot of people, I like to get my medical information from bizarre, dark corners of the internet that haven't been vetted. Is that a good idea?
Oh dear.
Please do not continue to do that.
That is definitely not a good idea.
Unfortunately, on the internet, pretty much anyone can post anything.
There are no microchips. There's no stealing of your DNA. No, none of that is happening.
Thank you, doctors. All right, I'll let you get back to work. And thank you for allowing me to ask you these questions. But before you go, just want to let you know, your parents are super proud of you. It's all they can talk about.
So, and Robin, if you can click the next slide, you can see here some of the response we got to this video as it rolled out in early March. The issues that are raised in it respond to many of the questions that we saw in our survey research, as well as from the healthcare workers and community organizations that we were speaking with. And again, when we see people moving forward to get vaccines, we see many of these questions are still ones that bear reinforcing and that people want to know more about. Robin, the next slide, please. And just last week, we added 10 Latinx healthcare workers, doctors, nurses, and promotoras or community health workers to the campaign to respond to additional questions that we were hearing in the Latino community, both in English and Spanish. The campaign includes now more than 125 short FAQ videos. Next slide, please. You can see some examples of them here on the screen from the most recent videos that we've added with the Latinx doctors and nurses and healthcare workers. They address some of the most common questions that we continue to see in our research that people have, as well as questions and issues around access, cost in particular. Despite the fact that the vaccines are free, we know that many people still are concerned that they might have to pay for something. We've also heard concerns and questions about people's immigration status and whether the getting a vaccine will impact that, or if it's available to undocumented individuals. It is. So we've spent a lot of time developing messages to reinforce this content as well. Next slide. We have partnerships with the largest social media and digital media companies, including YouTube and Google, Facebook, Twitter, Pinterest, which are helping to amplify our content across their platforms. To date, since launch, we've had more than 7 million video views, which has amounted to more than 12 million minutes of content viewed. So we are getting significant visibility through digital and social platforms. We also know it's important to take the content out into the community. We've been really excited to be able to work with a number of community organizations and health departments to extend the reach of the content. A few examples of those include partnerships with faith-based organizations like the Ebenezer Baptist Church in Atlanta, Georgia, which has live streamed the videos as part of their sermons. We've also been working with the Black Conference of Faith Leaders to help use the videos for trainings and outreach efforts. Next slide. Another big partner is Fair Count. That's the group, Stacey Abrams' group, which has done a lot of work around census and voter outreach and now has pivoted to helping with final mile access to vaccine availability. We're working with them to take the messaging into rural communities and use it as part of their telehealth events and door-to-door outreach. That's being supported by a partnership with the Rockefeller Foundation. Next slide. We've also had a number of health departments that have been using the campaign as part of their outreach and efforts. This is from the California Department of Health, which has integrated the videos into their Vaccinate All 58 campaign and is helping to ensure that the content gets out to targeted communities. We've been working with health departments in LA County, New York City, and across the country to utilize the messaging. And then one last example that I wanted to share, next slide, please, is I think sort of one of the most exciting things for those of us who do public health messaging. These are some tweets that we've received from healthcare workers that are telling us about using the videos as they're sitting down across from patients talking about the vaccines and pulling up content to share with them to answer their questions and seeing decisions made in the moment to move forward with the vaccine, which is of course everything that we hope for with this content. All of the content is available rights free and available for community use and education. You can access it through our YouTube page at youtube.com/greaterthancovid, as well as on our website, Between Us About Us. And we continue to add new content as the conversation moves forward. Next slide. I also just want to close and recognize, as I mentioned at the beginning, we do a lot of our work in partnership with other foundations, and this project has been supported by a number of other foundations that I'd be remiss if I didn't call out here, including the California Healthcare Foundation, which has helped develop both the messaging for Black and Latinx communities, the Commonwealth Fund, the Sierra Health Foundation, the California Community Foundation, and the California Endowment is helping us get out the messaging in Southern California. So I want to thank and recognize all of them for their support and work. And with that, I'm going to turn it back to Vince.
Yeah, and Tina, I know that because of your depleted phone battery, you may not be able to stay with us through the entire presentation, but I want to take advantage of your presence with us now to ask maybe just a few questions about your presentation. One is just as quickly as you guys were able to get this really impressive program together, it's already up and distributed massively. Do you have any sense of what the uptake has been, and if at least the data is going in the right direction, what kind of, if you have any indications of impact, or how you will know if you will have an impact? How do you think about those questions?
Yeah, I mean, this is certainly one of the fastest moving public education type responses that I think anybody's been involved with. As you mentioned, sort of, there's a need to kind of move very fast, which we recognize. We were developing the messages and really worked to get it out there. We've had more than 7 million views of the content. That's just what we're able to measure through the digital platforms, and many more through the community partners that we're working with. Many additional views from the community partners to also get it out there. Through the Kaiser Vaccine Monitor Project, which is in the field every couple of weeks, collecting data about different communities' access and information needs around the vaccine. We are things move forward, and we know that information and getting people good information is a big part of helping those, particularly in the wait and see category, move forward to go from considering a vaccine to getting it. In our most data, which just came out 2 weeks ago and focused on the Latino community, we saw a particular opportunity to get good information out, particularly around cost and access issues. It's not to say that there certainly aren't barriers in helping people physically get to vaccine sites, transportation issues, timing of sites, but we also know that a lot of people still don't know that the vaccines are free. They don't know that they're available to everyone regardless of immigration status. So we've spent a lot of time with that messaging, also trying to support and get out that information, as well as connect community groups.
Great. Yeah, I think we've learned that what might have been assumed to be concerns for vaccine hesitancy were more likely vaccine reluctance or lack of specific knowledge, wait and see, but also lack of access. And I think we're going to hear about access questions as well with the remaining presenters here too. The data from the Kaiser Monitor, I think, was really interesting. Is there any specific part of the data that you found struck as particularly persuasive, that there's a pleasantly surprised in the monitor?
Well, again, we're seeing that people are moving forward and making decisions. The wait and see isn't, for the most part, has been a movable group and movable information. And I think the questions, when you look at at the information needs people have. I think if you think about it, they're very reasonable questions that people will have. You know, this was a fast process. We also were talking to communities that have faced issues around racism and distrust of the healthcare system. So there may be information that needs to be provided to help people understand what went into this and how, you know, you heard some of the researchers talk about how Black and Brown communities were involved in the process.
Yeah.
And I think highlighting all of those aspects of how we got here is really critical to help people feel confident and comfortable about making this decision for themselves and their families.
Great. And the other thing, the last item I wanted to call out was in your presentation, you talked about the relationship with local community organizations and Fair Count being one of them. I think one of the things we're hearing, and we did a joint program with Grantmakers in Health and United Philanthropy Forum and other organizations in addressing the question of civic infrastructure, and that there was a lot of civic infrastructure built for collaboration in communities, for the census, for collaboration around voter registration. So these major civic functions that are generally once every 10 years or once every 4 years. And then the pandemic is like something that happens once every 100 years. So far, hopefully it'll be another 100 years. But these are the same sort of civic collaborations and resources. And I think you're speaking to it a little bit there. I wonder if you just would maybe dive in a little bit more on that question of civic infrastructure and how that plays here.
Yeah, absolutely. I mean, this is, you know, we created this as a media campaign. It's built on a series of video products that are meant to be accessible and easily accessed and address questions people have. And, you know, certainly those digital and social platforms and partnerships I mentioned are critical to getting them out there, but so are these partnerships. And I think especially with the stage that we're in right now with vaccine outreach, and that's sort of what we've looked to do is marry our media content with those partners that are working on the ground that, as you said, have a long history of working in the community, making those connections. With the Latinx campaign that we just added, the involvement of promotoras, the community health workers was, you know, very intentional. Those are some of the folks that are really helping people cross that last mile, whether it's literally how to get onto a website and book an appointment, or to, you know, help reinforce the availability that these vaccines will not compromise immigration, raise immigration concerns for people and their families, costs, even personal experiences. And so I think those partnerships we see as critical and something that we're really looking to also elevate as we all move forward this summer.
Wonderful. And I'm hopeful that we can find the link to that collaborative program we did around civic infrastructure too, for anybody who's watching this on live or on the video. So thank you for sticking around for a few questions there. Hopefully your battery won't die while your power is out. It was a great presentation. And before I turn to our next presenter, I just want to say a quick thank you to Roshni Melia, who's our communications coordinator for our program coordinator for these things. It's really her work in design and logistics that makes these things really go smoothly. So appreciate her. She's going to have to sign off before the end. And I want to just thank her for all her work in making this happen. And now we're going to turn to Estelle Willie, who is the Director of Health Policy and Communications in the Communications Policy and Advocacy Division at the Rockefeller Foundation. And you guys have been doing amazing work, very large scale work. And it's really interesting to see where communications fits into your work. So thanks for making time to join us for this discussion. Estelle.
Thank you so much. I'm really glad to be here and see everyone. Let me just share my screen really quickly. So as Vince said, we have been doing a lot around the COVID response and recovery efforts. And so I'm just going to focus on two pieces of this and just give a brief overview, and then hopefully I can answer some questions at the end. The first one is about our U.S. Equity First Vaccination Initiative. And just building off of the comments that Tina just presented, we wanted to focus in on building capacity within community-based organizations. The medical field, the doctors, nurses, medical professionals, they are a trusted messenger, but actually community-based organizations are another group of trusted messengers that really understand the pulse of the community, are from within the community themselves, and really can be a really great trusted messenger to increase people's willingness to get vaccinated. And given that the infrastructure that they have in place for voting, get out the vote efforts, for census efforts, we wanted to build on that and increase their capacity to have these conversations that they might necessarily not feel comfortable having, because it's about medicine, it's about science, and it's ever evolving during this pandemic. So just zooming out a bit, this is part of a much larger comprehensive program. It's centered in 5 cities. We have anchor organizations, including OSI in Baltimore, and it's we have advocacy partners, we have service partners like Lyft and Uber, and then we also have the communications partners and learning partners that are actually measuring, evaluating the impact of all of the collective work that we're doing. The short-term goal for us is to reduce the racial disparities in vaccination uptake, but really the longer-term goal is using this as a use case to really call for strengthening the US public health system as a whole. So this is a slide with way too much information on it, but just to give you an overview of the depth and the breadth of what we're doing here, we have, the anchor partners that are working with around 200 community-based organizations within those cities. We have learning partners, RAND Mathematica, Brown School of Public Health, really measuring, evaluating what is working, our communications partners, which I'll get to in a bit, and then of course, some national advocacy and service partners really helping take the learnings from these 5 cities and really scaling it nationally. So for the communications piece, like I said, we're really trying to build capacity within the CBOs. People have valid questions and concerns, and they want to feel confident about making informed decisions about getting the vaccine. And with the community-based organizations, we have paired them with 3 communications partners that are all working together in sync. So CBOs don't necessarily know that there's like 3 different partners, but they're all working together. So Public Good Projects, First Draft News, and then Brown School of Public Health. I'm not sure if you all know these different organizations, but PGP, they specialize in taking the techniques from the private sector, marketing, social listening, behavior change programs, and applying it to public health practice. Really taking data science and behavioral insights to inform the work that they do. First Draft News, premier organization focused on the challenges of the information disorder, misinformation, disinformation, and they also have deep expertise working within communities of color. And then Brown School of Public Health, experts in crisis communications, experts on rapid fire evidence-based communications, talking points, whatnot. And then on the back end, they're also measuring and evaluating in a very rigorous way to see if these new models of building capacity actually last beyond the COVID-19 vaccination work that we're all doing. Really quickly, we are working with Public Goods Project. They're really the project manager of this whole piece of work, but they're really focusing on doing the needs assessment, working on the social listening bit, working with First Draft News and understanding what those information gaps are, and then providing the communications guidance on how to respond to the misinformation that's circulating both online and offline in real time, and also developing creative materials social media assets, whatever handouts, whatever is best needed for CBOs, because we know that many don't have that capacity at the moment. So we are including that in there. And then also, because we know that communications needs to be multidimensional, people need to hear something at least 7 times before it really registers, right? I think we all know that. We also are working with social media influencers as well as other influencers in the community, giving them prompts and messaging and letting them have the freedom to tailor the communications to their audience in their own voice and perspective. First Draft News, they are about to embark on some really great masterclass trainings to really train up community-based organizations on how to identify mis and disinformation, and then whether or not to respond and how to do that and how to make those decisions. They're also doing the monitoring in the communities and then also nationally giving recommendations to the CBOs. And also, and that includes reporting. And then they are also working with community-based organizations on a tip line tool to really make it as easy as possible for CBOs when they're hearing something to share it with the team so that we can understand what's out there. And then of course, Brown School of Public Health, they're supporting all of the work that PGP and First Draft News are doing. They're developing that evidence-based talking points and information just to ensure that what we're saying is accurate, right? And then also the learnings, really assessing the overall program using quantitative and qualitative tools to surface insights on what worked and what did not work to help inform programs moving forward. And then a big thing for us is ensuring that there's this continuous feedback loop. A lot of times public health communications are often top-down, going into communities, and then communities have questions and there's not that much engagement. Honestly, from working with the CDC in the past, it's a lot to do with the delay in getting things approved, communications approved. So we just wanted to make sure that everything that we're doing has a continuous feedback loop and we're iterating as we go. So that is the piece of work that we're doing here, working with community-based organizations. I'm not sure if we have time, but I had another little piece that I wanted to share with you all just really, really quickly. We also do quarterly messaging surveys that help many different organizations on like what messaging actually motivates people to get the vaccine, but we also do testing, masking, all of the protective behaviors. We recently just put out a vaccine confidence message brief. We're about to put one out on testing fatigue. But just really quickly, it's a nationally representative survey. We both look at what is the pulse of what's going on, but then also test messaging out in focus groups as well as the survey. So we pair them together. For this one, we focused on Black and Latina frontline workers, K-12 teachers, and healthcare workers below the doctor level. Because we were hearing that, some staff at hospitals just didn't even want to get vaccinated. So we wanted to understand that. And so for this specific message brief, we included the insights, the message do's and don'ts, and then recommendations for framing the conversation. I know I'm completely out of time here, but in the message brief, I'll send the link around. You guys can see all of this. But it just gives some really great advice. And then we see here a bunch of different organizations are using these message frames in their own messaging. We're also working with Global Citizen on their national campaign focused on BIPOC communities, and they have used the insights from the survey. And also the Disinfo Defense League has also been using the vaccine message brief in their work with community-based organizations. So I put the link down in the slide here, and I hope it's in the chat as well, so you guys can look at it. But really, it's just as a public good for all of you working on different campaigns. And here's my email if you guys want to reach out. Specifically, the communications piece of the Equity First Vaccination Initiative. We're in 5 cities. We are talking to other funders to expand it to additional cities because we do have that infrastructure and the learning partners in place already. So if you guys are interested in that, we'd be happy to talk more.
Great, thank you, Estelle.
Yeah.
And I didn't want you to feel rushed. You have time to present everything you shared with us. It was really great to see both aspects of it. Maybe I could just ask you to briefly go back to, you don't have to bring your slides up, but the circular slide that talked about sort of impact. Can you say a few more words about like how you think about gauging the impact of the work that you're supporting? And it seems like a really important and intrinsic aspect of your work. And
yeah.
How will you know?
Yeah, so we're actually we're partnering with Mathematica, Rand Corporation, and Brown School of Public Health on this issue, because so much of the communication metrics are, how many people clicked on something, how many people watched something, but it's really hard to understand, okay, what action did they take after? And that's what we're really hoping to do here. We have a monthly pulse survey that we're doing to really understand how people heard the messaging and what did they do afterwards. So that's one piece. We're also doing focus group testing, focus group, I can't talk, focus groups to really understand, like, okay, you got the message, what types of messaging work, how did the messaging, who said it that made you want to go get a vaccine. So that type of thing that we're doing. The other thing is, we know from the research that we've done that access and confidence are so intertwined. So if people can't get access to something, doesn't matter how many messages that they receive, they still won't be able to get the vaccine. So a lot of the measurement and evaluation, we're pairing the access issues with the communications issues together to really understand that link. So yeah, it's a very comprehensive evaluation, but we just feel like it hasn't really been done in this way, as rigorous in this way before. So we're really hoping that this could be, published, people can see the results of it and really help inform the work moving forward.
Great. Well, keep us informed. We have an area of work in our network around assessing the impact of media. There's definitely a large group of funders who really care deeply about this. We'll be coming back to that that topic soon and frequently, and maybe we can come back to you to bring that discussion into that part of our network as well. But you provide a good segue, because I think what Brett Davidson is going to address is really access and equitable access to the vaccine. Up until now, we've been talking pretty much US domestic, but Brett is director of media narratives for the Open Society Foundations, and they're interested at OSF in global access as well. And so, Brett, maybe you could share what you're working on about access.
Sure, and thanks so much, Vince. I'm just going to get my slides up. That is the wrong thing. Sorry, 1 second.
No problem.
There we go. Okay. So yeah, so for a number of years, Open Society Foundation has supported access to medicines, and we worked on access to medicines, and particularly concerned about the pricing of medicines and the way that patents ensure that medicines remain expensive, despite the fact that actually a lot of medicines, many of them are developed with public input, and obviously the COVID vaccines, really had a lot of public money and taxpayer money invested in them. So as you said, we are also concerned about global access, because I think the message has come across that unless everyone around the world gets access to the vaccine. And even though we've been vaccinated in the US, that doesn't help. Well, at first of all, that's really unfair and discriminatory, but it doesn't help also us get, the world back going, the economy going, travel going, but also it leaves the virus to circulate and new variants to develop, and so will undermine the impact and the effectiveness of the vaccines ultimately. So it's crucial that we have equitable access internationally. And so, as I said, OSF has been doing this work on access to medicines for a number of years and funding this work. And I think, in 2014, there was a lot of sort of movement around this during the era of AIDS, obviously, which made ARVs affordable and accessible. But over the years, this work had become highly technical and really had become restricted to sort of small groups around the world and individuals who had really a really technical understanding of the laws around patents, the World Trade Organization laws around these things, how medicines work, how they're developed, and so on. And so those groups also were then used to arguing behind closed doors in small venues about these highly technical aspects of policy. And back in 2014, we were already thinking about how can we support these groups to really reach a broad audience and really connect with broader health and sort of human rights movements to advance this work on sort of medicine pricing and work to get the price of medicines brought down. So one of the things we supported back in 2014 was a group called the Center for Artistic Activism to put on a training in Barcelona for access to medicines activists around the world on creative activism. And so one of the things that this resulted in was this act after the 5 days of workshops, this kind of public action where we had a sort of roulette wheel and sort of people had to, play their kind of game, Wheel of Fortune, and kind of getting across the message, really the pricing of, and this was connected to a new hepatitis C drug, that the pricing of medicines is totally arbitrary and depends on what the drug companies want to charge. And this is outrageous. Anyway, that happened in 2014. And those people stayed in touch, and also the Center for Artistic Activism, which is based in the US, stayed in touch with their graduates of their programs and stayed talking. And so by the time that COVID came around, Universities Allied for Essential Medicines, which is students around the world working to push their universities to ensure that any medicines that they develop at these universities are licensed in a way that ensures access to countries globally and to the poorer countries, partnered with the Center for Artistic Activism on a campaign called Free the Vaccine. And what they did was that they recruited cohorts of people, 300 to 400 people around the world, working in small teams, and each week taking them through kind of developing and brainstorming and executing actions to try and get scientists and researchers to commit to ensuring that an eventual vaccine would be freely accessible to everyone. So this is their logo, and they have their own website. So they started doing all sorts of things. Someone created a song to the tune of Dolly Parton's Jolene, but of course using the word vaccine and all these kinds of things. While this was happening at the start of the pandemic in April last year, Oxfam and UNAIDS had the idea that access would be an issue. They put out a press release at that time without any sort of detailed policy, but setting out a set of basic principles, the UNAIDS People's Vaccine Statements. So this is a shot from their website. The People's Vaccine should be available to all, everywhere, free of charge. And their key demands were really to call on governments and pharmaceutical corporations to ensure the vaccine is purchased at true cost prices and provided free of charge to people, prevent monopolies on vaccine and treatment production, ensure the vaccine is sold at affordable prices, and implement fair allocation of the vaccine, prioritizing health workers and other at-risk groups in all countries. They asked OSF to come on board to assist, and so OSF played a number of roles. One of the things we did, our then president, Patrick Gaspard, became a signatory to the People's Vaccine, and my colleagues in the public health program started reaching out to many current and former heads of state, as well as many of our grantees, and bringing them into this campaign. So we sit on the steering committee of the People's Vaccine Initiative, and we've been really, one of the things that we've been doing is helping play a role in getting influential people to sign on, former heads of state, Nobel laureates, influential global human rights leaders, and so on. Here are some of the names that have come out in support of the People's Vaccine campaign. And then all of our long-term health, global health financing and access to medicines grantees became part of the campaign. Health Gap, Public Citizen, Frontline AIDS. And the other role I think that we played was connecting organizations and activists in the US with this global movement that we'd been supporting over the years of access to health and access to medicines, the movement. And those organizations coordinated, also joined the People's Vaccine. collaboration. So the Free the Vaccine group, which I mentioned earlier, then joined the People's Vaccine Movement, and they've really been responsible for some of the edgier and more creative actions, and I'll get to that in a moment. So sticking with the People's Vaccine now, they've been creating a number of media as well to get out the message. They have all sorts of sort of rallies online, as well as sort of physical rallies and events. Recently, I think all of these groups combined helped secure the Biden administration's commitment to supporting a patent waiver. So that was really a huge win for this movement. And I think one of the, really the first time that the US government has done something like this. So an enormous breakthrough. And then recently, the People's Vaccine came out with this message about how many billionaires have been created by the vaccine. So I'll just show you that. So it's just one of the sort of short videos they've put out. They have some posters and all sorts of things. And if you can go to their website, you can see a lot of the other things that they've developed. And then the Free the Vaccine Coalition, as I said, they've really been responsible for some of the edgier and more innovative actions. So this is an example. Here's some examples of things that their cohorts have been doing around the world. So in London, a carnival march for a people's vaccine. In Melbourne, they produced a stop motion sort of animated video, Free the Vaccine. There was the respiratory therapist for a free vaccine in Seattle, something called Goodnight Stories for rebel scientists in Amsterdam. There was a people's shareholder meeting, in other words, getting across this point that we actually paid our tax dollars went into the fundamental, really developing these vaccines. We should have access to them. And so the people got getting that idea across. And then the Care Bears appeared in the mall in Washington, D.C., and around the time that pressuring the US to support the patent waiver, which they subsequently did. And just to sort of talk about some of the other sort of media, this is a song that one of the Free the Vaccine supporters, DJ Shalant, created using the words of Jonas Salk, who developed the polio vaccine, who famously said he wouldn't patent the vaccine and, could you patent the sun? In other words, this is something that belongs to everyone, just like the sun.
Who owns the patent on this vaccine? Well, the people, I would say. There is no patent. This is, could you patent the sun? Who owns the patent on this vaccine? The people, I would say. Who owns the patent on this vaccine? Could you patent the sun? Who owns the patent on this vaccine? The people, I would say. Who owns the patent on this vaccine?
All right, so that's just one example. And I think that really the kind of great thing about this campaign is that it really pulls in people with their artistic talents, and people have been contributing their talents, their skills, their expertise, and really producing things without a kind of centrally kind of directed approach. So this is really people working in coordination all around the world. And in this most recent video from Free the Vaccine really parodies, I think, something that's very familiar to people in the US, which is the famous video that I think many school kids have been exposed to around how a bill becomes a law, but this is all about the vaccine.
I'm just a vaccine.
Woof. You sure gotta climb a lot of steps to access this pharmaceutical corporation. But I wonder who that sad little syringe is.
I'm a vaccine. Yeah, I'm just a vaccine, waiting for my distribution to begin. Well, it's a long, long journey from research to patents, then more time to spend on trials and marketing. I just hope I won't be monopolized, at least I hope and pray I'll be free. But today I am just a vaccine.
Vaccine? I don't understand. I thought you were free.
Maybe for you in the US, but most of the world still can't get the vaccine. Pharmaceuticals need to share their research so that other countries can make their own vaccines.
You mean like people in high-income countries get vaccinated first, while people in poorer countries have to wait?
Exactly. All the while, new strands of COVID develop. I'm a vaccine. Yeah, I'm just a vaccine, made from your hard-earned money. Yes, your tax dollars funded me, so sit with me and wait. Observe our pharmaceuticals, discuss and debate how much profit they want to make. How I hope and pray that they will make me sustainable from goodwill.
Gee, listen to the World Trade Organization arguing in there.
I hope the WHO decides to share my patents globally. Otherwise, I won't be able to fulfill my true purpose and save lives.
Why are these patents so bad, Vaccine?
Like I said, kid, patents make it so that only a handful of companies can produce me and charge whatever they want because they know how badly the world needs me. But it looks like more kids like you are learning and taking action. No one is safe until everyone has access to the vaccine. We want a people's vaccine, not a profit. Learn more about how it is possible to change the pipeline of a vaccine and why it's important that everyone around the world has access to the vaccine. Visit freethevaccine.org.
So just some examples there. And I think, obviously I said this Biden administration commitment to the patent waiver was great, but, there are many countries that still oppose that. So next steps, I think, are to, put pressure on those countries, including Germany and the EU, and then to help grow the voice of the global South, talking about the cost of inaction and also their readiness to manufacture vaccines. Thanks.
Great. Thanks for that. And I guess that was based on Schoolhouse Rock. Is that right? Is that
That's
what that?
it. Yes,
I'm just
exactly.
a Bill. Yeah.
Yeah.
I think we all remember that. Thanks for sharing. Really appreciate that. I wonder if you could say just a few words on, it was, I think, a pretty big surprise to see the Biden administration come back on the waiver. Do you have any sense of what the advocacy campaigns contributed to that decision? And a related question is, what is the role of foundations? Do you have thoughts on what the funders can do in supporting these campaigns?
So we don't have any sort of formal measurement of what the advocacy campaigns contributed, but I think they played a large role. And I think, going to this role of talking about the role of foundations, I think one thing was really to support a diverse field. So from the sort of actors who can play more of an outsider role and put outsider pressure to the insider, people who they're in the policy tables and are trusted by the administration and can kind of make those arguments. And I think we've played a role in supporting that range. And I think almost all of the key organizations pushing for this have been OSF grantees over the years, so from behind the scenes, getting influential people to, pick up the phone and talk or write letters in support to, the Free the Vaccine getting a range and hundreds and hundreds of people to call and push for this. I think it did play a huge role. Talking more generally about the role of foundations, I think really, to support the building of a movement is really important and be in it for the long haul. That when we did that sort of campaign and that training in 2014, we'd had no idea that these groups would come together, 6-7 years later and do this global campaign. So I think that really sowed the seeds, but unless we continued supporting those groups over the years, that wouldn't have been ready to take off. And I think, showing that we're supporting people who want to take edgy and sort of creative actions and push the boundaries a bit and be there and indicate our support, I think is really important.
Great. Yeah, well, it seems to have paid off. And it's great to have the kind of creative and technical skills to do that. I wonder if we could get Estelle and Robin to turn their cameras back on. We've got a couple of questions. I think we'll go to Robin Kistler from Kaiser Family Foundation for the first question, offered anonymously. Is there any talk of the conversation targeted at rural, conservative, and white populations? Or something similar?
Finding the unmute button. We've been talking about rural and white populations since a year ago. So, we're looking at populations and who needs information. I'm just going to share my screen really quickly in support of this question, which I really appreciate. So this is the COVID vaccine monitor that Tina, I'm not Tina, you heard from Tina early on. I'm her right arm. We've been working together for 15 years. She had mentioned our representative sample campaigns that are out, and you can see rural, as this is uptake in terms of who has already gotten or wants it ASAP, right? So low numbers means folks have not gotten vaccinated. The rural numbers are pretty low at 55%, Republicans 55%. Those are predominantly white folks. And the other group that I would point out is the 18 to 29-year-olds, young people, are even lower than that. So another opportunity of focus. We don't know yet whether we'll be expanding to white and rural populations. I think we probably have our hands full with Black and Latinx groups. As Tina mentioned, our work really is rooted in HIV, and so we have extensive community networks and just years of experience working with Black and Latinx Americans. So I don't know. We haven't decided yet. There were many late nights to get out 130 videos last Thursday, so we're taking a moment to breathe before we make decisions. I do think another group that we want to be mindful of are younger than the 18-year-olds. So as vaccine access expands down to the under 12 set, thinking about parents and working through schools and opportunities to help families make decisions about vaccinating their kids. And we're wondering if there might be a beneficial effect of, if it's safe enough for my kids, maybe it's safe enough for me too, for adults this fall who maybe haven't made the decision to get vaccinated at that point.
So you can't tailor messages for absolutely every demographic, but you're still thinking about that too.
I have been asked for messages for every demographic,
but you can't quite do it.
Support the need. We may. I'm not saying we aren't, but we haven't.
And you guys partner with other funders, so if people see that opportunity, then presumably, you can find the resources for it. You can actually develop more activities. And I do see that there are some really thoughtful folks on the listening in, from Howard Hughes and from Hillman and Helmsley and Ford. We still have a couple minutes for questions if you have something burning, but I do have a question from Nina Sachdev, our communications director. And I think this is for Estelle. Perhaps you're seeing the question, what have we learned about combating and approaching science denialism? I see that you're working closely with First Draft. They're clearly working in this area. Are there any key insights you'd like to share from your work that could be applied to tackling other urgent issues of science denialism, like climate change, et cetera?
Yeah, it's a really good question. I think so much of the COVID pandemic has exposed so many issues, and one of the issues is the disinformation and misinformation, and how it impacts science denialism and increases it. And I think from what we've seen through this past year is that it is systemic. And for us, I was actually kind of shocked by the lack of evidence and research on new innovations, new tools, and whatnot to fight and counter dis and misinformation. Because let's be honest, misinformation and disinformation have occurred since the beginning of time in many different ways. But I think the onset of social media and how quickly and easy things can spread from a local source to globally, almost in a viral way, means that we need to be pivoting. But we don't actually have a lot of data and insights on how to do that appropriately, and whether something that works in one geography or one area can work in other areas. So what we are doing from just this past year of like seeing this and really coming to the forefront at the Rockefeller Foundation as a big issue is that we're actually about to embark on investing in some of this research to really build that evidence, to understand what we can do, what we should be doing to move forward in this space and really approach the science denialism that goes far beyond just COVID-19.
Great. I think that's really a great perspective, and I think it actually brings us to as we close this conversation, it reminds us that what we're going to be addressing in the fifth and final session of our Media Impact Forum is going to be the importance of evidence-based communications for the health of our democracy too, because I think it's not just the implications for science, for health and the environment as specific areas of concern, as encompassing as those are, but actually the health of our democracy too. We need a solid base of factual shared information around which we can make civic decisions and can, engage in democratic practice. And so we're going to be returning to that large topic on June 16th when we do our final session of the forum. But today I just want to thank you all for really great presentations on how we can make sure that all communities have access to and understand their opportunities to obtain the vaccine. And let's keep in touch as we learn more about the impact we're having in all of these programs too. So thank you all for your presentations. Thanks everyone for listening.
Thank you. Take good care.
Bye.